अच्छा
हो गई, स्टार्ट हो
ओके
गई
सर
सर।
No, it's okay, Vivek. If it
हाँ
goes to cloud now, you can send it on mail and it becomes easier.
yeah yes sir, that is good. Later on we can download that also.
Yes.
समीर जी, इसमें रिकॉर्डिंग हो रही है, पता कैसे पड़ेगा सर?
Once you get the notification, no,
या
that the meeting is being recorded, जब तक आप उसको switch नहीं दबाएंगे,
हाँ
तब
तब तक
तक
हो रही
रिकॉर्ड। हाँ हाँ
है। अच्छा ठीक है, क्योंकि इसमें दो ऑप्शन दिख रहे हैं बाद में कि पॉज या स्टॉप रिकॉर्डिंग। अभी मैंने कुछ
नो
नहीं
नो
किया,
नो नो
मैंने
नो, कुछ मत
रिकॉर्डिंग
कीजिए।
स्टार्ट कर
हाँ
दी
हाँ,
है।
बस बस।
एक एक ऐसा होना चाहिए ना, तो लाइट जलती रहे तो पता रहेगा रिकॉर्डिंग हो रही है। जैसे ओटी के
ठीक है।
बाहर लाइट जलती रहती है, सर्जरी इज ऑन।
नहीं, इसमें ना कभी स्क्रीन के ऊपर डिस्ट्रैक्शन हो जाती है।
हाँ सही, राइट।
Good evening, everyone. Dr. Sankalp here. I
या
have
हाँ,
logged
गुड
in.
इवनिंग डॉक्टर संकल्प जी।
हाँ, नमस्ते sir. Good
वेरी गुड
evening.
इवनिंग सर।
हाँ,
नमस्कार संकल्प जी।
नमस्ते sir. I have logged in. Should I
Yeah.
share?
You-
I mean,
या जस्ट उसको चेक कर लो अपना,
हाँ,
क्या बताएं,
screen को
प्रेजेंटेशन
share
को।
करना होगा ना?
हाँ, you'll have to allow that, डॉक्टर प्रकाश।
हाँ, शेयर वाला कर दूं ना, शेयर ऑल?
हाँ हाँ हाँ, मोर में जाइए, मीटिंग सेटिंग्स।
नहीं, नहीं, इसमें शेयर में तो ऐसा कुछ भी नहीं लग रहा है सर।
एक मिनट, एक मिनट, ये रहा। ठीक है, he is able to share.
ओके ओके।
That's fine. Sankalp, it's fine.
I can't see. That's why I'm just trying to.
ओके, शेयर हो रहा है सर आपका?
अच्छा. My screen is visible to you, right?
यस
I'm
Yes,
changing slides.
yes.
It's all visible.
Yeah,
Yes,
yeah,
yes,
it is, it
Perfect.
is.
So should I stop it right now?
Yeah, अभी के लिए थोड़ा
स्टॉप कर
बंद
लें
रखो।
सर।
डॉक्टर आर्या,
यस
आप
सर।
अपना स्क्रीन मत शेयर कीजिए, इसलिए उसको दिख नहीं रहा था। आप अपना
ओके
अपना
ओके, मैं
हाँ
नहीं
हाँ
करूंगा
हाँ
इससे।
हाँ 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 हाँ, आप
तो
अपना स्क्रीन शेयर बंद कर लीजिए।
अच्छा, ये मैं बंद कर दूं, है ना? इसमें आ रहा
हाँ
है यू
हाँ,
आर शेयरिंग द स्क्रीन, स्टॉप कर दिया मैंने अपना।
हाँ,
ठीक
स्टॉप
है।
कर दीजिए। ठीक है,
तो जैसे मैं और लोगों को कैसे शेयर करने के लिए बोल सकता हूँ?
बता रहा हूँ आपको, जस्ट मिनट।
सेटिंग है ना इसमें
नहीं,
आती है?
सेटिंग में वो ऑलरेडी विवेक ने करके रखा है,
करके
सो आप
रखा,
कुछ।
फिर ठीक
हाँ
है
हाँ,
सर। नमस्कार प्रजापति सर जी, नमस्कार सर। सर
नमस्कार नमस्कार
सर
आर्या जी, क्या
सर
चाल है?
सर बढ़िया हूँ सर, बढ़िया
सब
सर।
बढ़िया है।
हाँ जी सर।
सभी लोगों को नमस्कार।
नमस्कार सर, नमस्कार।
आज बड़ा अच्छा टॉपिक है।
हम्म।
कामिक सर आप को होस्ट ले लेना, क्योंकि होस्ट
हाँ
प्रकाश
हाँ
सर को
हाँ,
बना दिया।
नहीं नहीं, मेरे को भी बना दो।
हाँ बना दिया सर आपको।
आयु को होस्ट सर, मेरे को भी बना दो सर, कुछ तकलीफ हो तो, क्यों मैं ऑलरेडी शेयर्ड एज ए होस्ट। सो
ओके,
प्रकाश
जस्ट
सर,
अ मिनट, जस्ट अ मिनट।
इफ इन केस एनी प्रॉब्लम।
हाँ, तो ये ओरिजिनल होस्ट किसके पास है?
प्रकाश सर,
ओरिजिनल तो
प्रकाश सर।
विवेक हैं।
प्रकाश
नहीं नहीं
जी,
नहीं,
आप
नहीं प्रकाश सर आपका नहीं है तो
अच्छा,
यू
मैं
मेक
हूँ।
एन co-host.
ओहो,
Yeah, you can co-host of Shamik sir and me also, IAP AHA.
तो होस्ट टूल में अब जाना है क्या मेरे को?
भाई पार्टिसिपेंट में जाके सर,
पार्टिसिपेंट में गया।
उधर में शामिक सर या पिन दिखता ना सर, ये 3 You click on that and make a co-host.
पार्टिसिपेंट में गए और शामिक जी को मेरे को शामिक जी को होस्ट बना दिया लो
Yeah.
Yeah,
And
you make a co-host, sir.
IAP
हाँ, yes,
and
sir. IAPAHA.
IAPAHA
को
को
भी
भी कर
होस्ट
दें,
बना दीजिए. हाँ.
इनको भी को होस्ट कर दिया.
नमस्कार
Speak.
डॉक्टर आर्या.
नमस्कार सर,
डॉक्टर
प्रणाम सर,
सभी को
प्रणाम सर.
नमस्कार.
Good evening all. Good evening all.
गुड इवनिंग संदीप सर.
नमस्कार नमस्कार.
नमस्कार सर.
Sedin sir, namaste.
नमस्ते सर जी.
जलील सर,
नमस्ते.
नमस्कार सर.
Namaste.
नमस्कार मिश्रा जी.
Morgan sir, Chandra Morgan sir,
नमस्कार
good
डॉक्टर
evening.
प्रजापति, कैसे हैं?
बहुत बढ़िया है. पढ़ने के लिए स्टूडेंट
गुड
तैयार.
इवनिंग चंद्रमोहन जी. जलील भाई गुड इवनिंग.
Good evening. Good evening.
सर नमस्कार सर. गुड इवनिंग सर. प्रजापति सर गुड
नमस्कार
इवनिंग.
गुड इवनिंग
चंद्रमोहन
सर.
जी.
वेरी वेरी गुड
वीर
इवनिंग
मिश्रा
सर.
सर गुड इवनिंग.
नमस्कार नमस्कार.
Chandra Morgan sir, good evening.
Sir, namaskar, Jalil sir.
How are you?
I'm fine, sir.
All good?
How is preparation for Coimbatore Pedicon?
Please, please.
Yes, sir.
You are most welcome, sir.
Yes, sir. प्रजापति सर थोड़े दुबले हो गए हैं.
दुबले हो गए सर.
जी सर.
नहीं, वो पोस्ट रिटायरमेंट जो है.
जी. नहीं, बट चेहरे पे सुकून भी है.
हाँ, पेंशन पे. चंद्रमोहन जी की जो स्माइल, बढ़िया वाली स्माइल देखने को मिलती है.
रिफ्रेशिंग स्माइल.
या
सरीन सर 5 जून को जयपुर आ रहे हैं सर. 5
हाँ
जुलाई
जी.
को. 5 जुलाई को जयपुर आ रहे हैं सर.
यस सर. पधारो सर, पधारो.
ठीक है सर,
बिल्कुल.
आपसे मुलाकात करते हैं.
जयपुर में पधारो, राजस्थान में पधारो, हमारा देश हम कहते हैं. पधारो हमारा देश.
हम भी आ रहे हैं सर.
सर पधारो सर. वेल मोस्ट वेलकम सर. हेमा बिंदु मैडम गुड इवनिंग.
Good evening, sir.
Good
Nice to see you
madam.
regularly.
हाँ जी.
Good evening,
थैंk यू
madam.
मैडम.
गुड
Good
इवनिंग
evening,
मैम.
Ravi sir.
नमस्कार
Good
हेमा मैम.
evening, sir. Prajapati sir. Namaskar, sir.
नमस्कार मैडम. नमस्कार नमस्कार.
Yes, sir. Chandramohan. Good evening.
Good
Dr.
evening, ma'am.
Vinay.
विनय
Dr.
सावत
Sharma,
सर गुड
Dr.
इवनिंग.
Vinay Aswad. Good
सावत
evening.
सर गुड इवनिंग.
Good evening.
Think,
आर.एन. शर्मा सर गुड इवनिंग.
गुड
Geeta
इवनिंग
Patil
सर.
madam
गुड
is
इवनिंग.
joined. Good evening, Dr. Geeta Patil.
all.
Dr. Sosele. Good evening. Dr. Jaydeep Chaudhary. Good evening, all of you. Anju madam is also joined.
Good evening, madam.
Good evening. Good evening. Kanya. Good evening.
Good evening,
Thank you for being with us.
Good evening, Dr. Hima.
Good evening, Geeta ji.
गीता मैम नमस्कार.
Namaste, namaste.
बहुत
So,
ज्यादा.
Dr. Arya sir, I think it's 9:01.
ये मैडम मैं वेलकम करता हूँ सबको.
एक 2 मिनट रुकते हैं सर. सुषमा मैडम
यस
को
मैडम, थोड़ी देर.
मेक अ कॉल.
ठीक
गुड
है.
इवनिंग डॉक्टर सेंथिल सर. डॉक्टर नेहा गुड इवनिंग. डॉक्टर शर्मा सर कैसे हैं सर?
सेंथिल सर वणक्कम.
वनकम.
ठीक, बढ़िया मैडम.
सेंथिल सर
Good
नमस्कार.
evening.
नमस्ते नमस्ते.
Yeah.
आज का शो डॉक्टर सेंथिल की तरफ से.
Yes. डॉक्टर आर्या सर,
या मैडम.
ये यूथ को भी है ना फॉरवर्ड करना चाहिए था थोड़ा सा.
अच्छा
आई ऑलवेज डू दैट, बट आप लोग अगर कम्युनिकेशन तो आप कम से कम अगर पूरा देख लीजिए सर, बिकॉज यूथ को
हाँ नहीं
जाएगा.
मैडम, आगे से मैं ध्यान रखूंगा कि यूथ ग्रुप में भी है ना फॉरवर्ड करके बता.
हाँ, because they will also know, because these are all very rare topics.
हाँ मतलब
but
वो तो अब
important.
अपने परिवार के फैमिली के पार्ट हैं. यूथ भी जो जुड़े हैं हमसे.
Vivek,
Madam available. Madam.
please forward to the youth groups
Okay, madam.
and alert them to join.
Okay, madam.
We'll wait for a couple of minutes. I just try to call Dr. Sushma.
स्नेहा जी नमस्कार मैडम।
नमस्ते नमस्ते
नमस्ते
गुड इवनिंग
नमस्ते
गुड
मैडम।
इवनिंग स्नेहा मैडम, गुड इवनिंग।
थैंक यू गुड इवनिंग
Good evening,
आर्यन
Sneha
सर
madam.
गुड
Very
इवनिंग।
good evening.
शर्मा सर गुड इवनिंग
Very good.
हिमा मेंदु मैडम गुड इवनिंग
शर्मा सर नमस्कार सर।
नमस्कार। आज तो भोपाल से हमारी रश्मि द्विवेदी मैडम ने भी ज्वाइन किया हुआ है। वेरी गुड इवनिंग मैडम।
Good evening, sir. Good evening, Senthil sir.
Dr. Prakash. Good evening,
Good
everybody.
evening, madam.
मैडम।
Good evening, Sneha madam. Good evening, Prajapati sir.
गुड इवनिंग
Good evening, Chandramohan
Good
sir.
evening, sir. Good
Good evening,
evening.
Shiva.
Good evening, madam.
Very good evening to everyone. A few of our pediatric dental colleagues have also joined.
Right,
So very, very warm welcome to all of them.
right.
The Sankalp has also
Kiriti sir,
circulated it
namaskar.
amongst his colleagues.
किरीटी सर, गुड इवनिंग सर।
Hello.
Good evening, sir.
Am I audible, sir?
Yes, sir.
Thank
You
you.
may send it, sir.
Thank you. Thank you.
मैडम 9:05 हो गए मैडम। कैन
गुड इवनिंग उज्जवल कुमार जी, गुड इवनिंग।
मैडम ज्वाइन कर लो। नहीं मैडम, हाँ अब वेट कर।
Sir.
हाँ जी मैडम।
Sir, I think Sushma ji joined you, sir. I tried calling her.
नहीं मैडम, उनसे बात कर ली है मैंने, वो जस्ट
ठीक
ज्वाइन हो
है।
रही है मैडम।
Okay. So we'll start, sir. Please start.
Yes madam, yes madam. Very warm good evening to all esteemed members attending this IAP AHA super specialty webinar in adolescent dental issues. I welcome guests from CIAP, guest of honor Dr. Prashant Subudh sir, IAP Vice President from East Zone, members from EB IAP, our own past chairpersons, Chairperson Dr. Hima Bindu Madam, Chairperson elect Dr. Sushma Desai, immediate past Chairperson Dr. Geeta Patil Madam, EB members of various zone and joint secretaries Shamik ji and my treasurer. I also welcome our guest speaker Dr. Sankal Tapania, moderator Dr. A. Senthil and various panelists, and our youth Mr. Salin Mitra. Now I invite our chairperson for her welcome speech and say a few words about the webinar. Dr. Hima Bindu Madam.
Thank you, Dr. Arya, sir,
Thank you.
Secretary of the Central AHA. First
you.
of all, a very good evening to all my dear seniors and colleagues of Adolescent Health Academy. And we always proudly call ourselves one of the biggest sub-chapters of IAP, Indian Academy of Pediatrics. And as we are all celebrating a silver jubilee year, 25 years of its existence, we feel proud that we are getting a lot of innovative programs running in through this year with the help of all the team members of the 2025 OBEB, and of course our youth who are also come in, and the parents as our, because we are working for them. We at the first time created a AHA Youth Forum where we'll be having their participation actively in all our fora. So we have taken certain decisions this year to make some landmark changes. One is to involve the young boys, the youth, for whom the Adolescent Health Academy has been working for the last 25 years. And we have done so much for them. Our past chairpersons have left a legacy which is very hard to catch up. But then we need to continue to work and strengthen the adolescent healthcare in India. And we need to be a role model across the globe. And we are working on the Empower Yuva being the theme for this year. So we want to empower our youth. We will always be saying young people ko ye chahiye, guidance chahiye, definitely. But I think after a period of 10 years, our youth are, if they're empowered, they can become good decision makers. In fact, we should look at making them good adults. So the transition where they are taking autonomy, this can be strengthened if we are empowering them. So empower is the theme. Empower Yuva is the theme for this year. Through this year, we are cascading the action plan of AHA, where the youth wellness is on the forefront on 4 to 5 priority areas. That is sexual wellness, digital wellness, mental wellness, metabolic wellness, and of course, vaccination. So these are the gray areas where we think there are gaps, and there are a lot of problems around these topics, and they are bold topics and that much needed topics. So these are the, apart from that, we are brought in the boy module, the adolescent boy module, and adolescent vaccination also will come into focus with the launch of our Tika at 10. And we also have this youth wave 18, which is actually for the youth. On every month of 18, we are doing some activities to empower Yuva and creating awareness on social issues across the all branches, and the IAP along with the association IAP. So this has gone well with the UNICEF, and appreciated the Adolescent Health Academy that the 18th of every month is a Youth Wellness Day, and they are collaborating with us. So with their help, we're also doing some youth consultations during our zonal conferences. Again, zonal Adults Cons is one of the landmark event for this year. And along with that, of course, the National Adults Con, which is the Silver Jubilee Adults Con at Ahmedabad. I request all my OBEB seniors and colleagues to join in large numbers in all our activities. And the webinar, which was conducted every month, this time we picked up super specialty topics for the webinars.
That's all. Hey.
Mute them, Dr. Mr. Vivek.
Madam.
Yeah.
Oh.
So Vivek, I mute karna hai. Yeah. So this adolescent super specialty topics have been covering well through our under the guidance of our scientific committee of Central. This month we have picked up adolescent dentistry, that is dental health or the adolescent dental topics, which is again less heard topic. All the topics are not well, not so much of discussion happens around this topic. So these are less heard but very important for the adolescent. So इसके बारे में जानकारी लेंगे, और all our members, our moderators, and Dr. Senthil sir has come forward, who's our EB member of South Zone, for moderating the sessions. I welcome all the specialists, the dental surgeons, the pediatric dentists on board. I can see Saranya and who's our dentist, Sankalji, yeah. And of course our other panelists, Vinay, Aswa, and Kanya, and others. And now we move, I request Dr. Daria to please call in our past chairperson, Dr. Geeta Patil and Sushma ji, chairperson-elect, for the few words before we start the scientific session.
Dr. Geeta Patil, madam, I invite you for the opening remark, madam.
Thank you very much, Himabindu madam and Prakash Virarya sir.
Thank you.
It's a novel idea that we are having this different webinars, which we have never covered before, is a dentistry, because we just know malocclusion, caries, but we are not knowing in depth. We may not do personally, but at least we can guide our adolescents and children. Thank you very much for arranging this. I will not take more time. I think happy learning. Wish you all the best. Thank you very much.
Thank you, Geeta ji. Sushma ji has joined.
नहीं मैडम अभी नहीं हाँ ज्वाइन कर लिया
Good evening. Good evening all. I am at a public place, so I will take hardly a few seconds to complete. And just it's a pleasure being here, and the topic itself is very much look forward. We all are facing, and the adolescents due to dynamic growth phase, a changing shape of the jaws and the face and everything, including, and their food habits, which we all know leads to a kind of issues like malocclusion and the caries and whatnot. So we look forward to learn a lot from the experts, and I'm sure it will be all the topics will be helpful for our adolescent health practice. Thank you so much for giving me an opportunity. Over to Prakash ji.
Thank you, madam.
I would like to welcome Dr. Kiriti also, who's been my colleague from Andhra Pradesh, from Tirupati, Professor of Pediatrics, and also Dr. Shiv Prakash Osale, who is joining us today. Thank you. Now, we do Vice President Dr. Prashant, who's our guest of honor. I hope he has joined. There's another.
Dr. Himabindu, thank you.
Prashant sir, welcome.
Yeah, please. Yeah, we welcome you, Dr. Prashant. And to erase our occasion, few words from you to bless the AHA.
Thank you, ma'am. AHA is very close to my heart. We are really thrilled to see this new innovative approach of AHA team led by Dr. Himabindu madam. And these innovative topics definitely will guide our practitioners and professionals to come up with a quality improvement in their practice. And the team, I was just going through the list of the topics which you have planned, and such a beautiful plan you have done that the topics are well informed to the speakers beforehand, and there are telephone calls and guest of honors and the conveners, everybody so well informed in time. You are starting, it's such a disciplined AHA is that my sincere appreciation to keep this up. And also, Dr. Himabindu, you are just going on opening new branches, adding young members, and your visit recently to Odisha to the Yuva Pedicon, that has really helped the Yuva to understand AHA, and many of the young pediatricians, they are now joining AHA and they are trying to understand how it can be helpful to them. So I congratulate you for this endeavor, and our Dr. Arya sir is also there. Thank you, sir, for giving me this opportunity and honor. My best wishes are with you for future endeavors also. Thank you very much. Thank you, sir.
Thank you, Prashant. We are looking forward for the Odisha branch to be inaugurated.
Yeah.
AHA branch. Thank you under your leadership. Thank you so much for giving your blessings. Yeah, thank you.
डॉक्टर एनसी प्रजापति सर भी हैं, उनसे बात
प्लीज सर, बहुत we are so blessed to see you. Charan Sparsh to you, please.
I am always there in this as a student, because these are some new fields which we are taking up, and it's really enriching us with the knowledge. Not only the pediatricians and the adolescent health professionals, and also our youths. So great going, and all best wishes. Thank you so much, Himabindu madam, for this, and Dr. Prakash Veer for this. Thank you.
Thank you, sir. Thank you. मैडम स्टार्ट करें, डॉक्टर संदीप सर को इनवाइट करते हैं।
डॉक्टर
संदीप मिश्रा सर, सुधीर मिश्रा सर, सुधीर मिश्रा सर।
यस सर, गुड इवनिंग, नमस्कार सभी को।
नमस्कार सर।
Shall we start the program?
Yes sir, yes sir.
Yes, Dr. Sudhir, sir.
So today we have like all our programs, we have the lecture on the preventive dentistry, and then we'll have a panel discussion, and we'll of course hear the youth voices. So I'll request the today the moderator for the panel discussion is Dr. Senthil, and Dr. Senthil comes from the Tamil Nadu, and he is a very active IAPN involved in community service. He has served the IAP as EB members multiple times and is currently a EB member of AHA. He has been EB member of AHA in past as well. An excellent speaker and academician, has published many papers and many presentations in national and international conferences also. So I welcome Dr. Senthil. Dr. Senthil will introduce the speakers.
Sir, do we have a lecture before the panel discussion?
And we have a lecture before the panel discussion.
I request Dr. Yeah, sir. Shall we have Dr. Shamik to introduce the first?
Dr. Shamik will introduce the
Shamik,
pediatric dentist delivering the lecture. Dr. Shamik, please.
Dr. Shamik Ghosh, our Joint Secretary, AHA.
Very, very good evening, and what you say, continuing our series of super specialty lectures, we have today compiled a small talk today on pediatric dentistry. And while we've been doing this, it was important to have someone who has been practicing pediatric dentistry with all dedication, with all focus. So we have Dr. Sankalp Taparia today. He is an exclusive pediatric dentist from Kolkata. He's been in pediatric dentistry for more than 20 years. He completed his bachelor's and his master's in pediatric dentistry from Manipal College of Dental Sciences, Bangalore in 2009, and very successfully runs a couple of clinics called the Happy Tooth. He has contributed chapters in various textbooks of pediatric dentistry, has several presentations at the national and the international levels, and has been invited as a guest speaker at various IDA, that is the Indian Dental Association branches. Happy Tooth was the first clinic in Eastern India to start using nitrous oxide oxygen sedation effectively and efficiently for their pediatric dental health patients for the last 12 years. The clinic has been taking care of the overall medical and dental health of the kids. It's my happy coincidence to also announce here that Sankalp's father is our esteemed colleague, Dr. N.K. Taparia, and he's been a pediatrician of repute, not only in Calcutta, but all over the state of West Bengal for the last 45 to 50 years. So he comes from a family that has pediatrics in its blood, and it is no surprise that Sankalp has dedicated his life to pediatric dentistry. So over to Sankalp for the lecture, Preventive Dentistry.
Thank you, sir. Thank you for those very kind words. I would like to thank IAP AHA Wing, President, Chairperson Ma'am Hema Bindu Ma'am, Dr. Shamik Ghosh sir for inviting me, Dr. Prakash, and all the esteemed senior faculty IAP torchbearers for this opportunity. And I would start with the topic right away. I will share my screen. I hope everybody will be able to see the screen. Is the screen visible to everyone?
Yes.
Yes, sir. Yes, sir. Go ahead.
So coming to today's topic right away, the topic is preventive dentistry for the adolescent, and it's a hand-in-glove relationship of a pediatric dentist with the pediatrician. So we will discuss preventive dentistry per se. How do you prevent problems? So greeting from the city of joy. My clinic is called Happy Tooth. I am Dr. Sankalp Tapriya, practicing pediatric dentistry as sir introduced in the city for a long time, and I've been kind enough to be referred by a lot of the pediatricians of the city. We are blessed to be getting kids on a regular basis, and thereby all the more important that I convey my gratitude to all the pediatricians who refer their cases to the respective dentists or pediatric dentists in their cities. Huge gratitude. Because of you, we are there. And so when you usually refer, what is the time when you refer an adolescent to a pediatric dentist? Is it never? Is it only for pain? Is it annually? Is it only when the parent requires, or is it very regularly? I believe there's a small QR code visible on your screen. You can scan that and you can punch in your answers. But nonetheless, I am sure that as aware pediatricians, you would be referring your patients very regularly to the pediatric dentist, or at least to a regular dentist nearby who would be treating kids and adolescents with special interest. Pediatric dentistry as a branch has developed over the last 25 years, rapidly growing as one of the most sought of branch in dentistry because of its nature of dealing with kids, and everybody finds it very unique and challenging at the same time to treat kids on a dental chair. Uh, think about it, we are the only specialty who would be practicing dentistry for kids or doing surgical procedures for kids when the child is in a live conscious state, and not performing surgical procedures in an unconscious or a general anesthesia stage. Many a times we're treating kids who are moving, squirming, crying in the chair, and even adolescents who are very fearful, sometimes very defiant, but still we get to treat the child and the adolescent in the dental chair. So why should we be looking at pediatric dentistry per se? To explore the various across the country are really involved in the process of treating kids with airway issues. You would have seen these teens with these kind of teeth, malaligned teeth, red gums, teeth all over the position, brown spots, hypoplastic spots, dental decay, crowding. You would see these very regularly in your day-to-day practice. The moment you open the child or the adolescent's mouth, you tend to look at the throat, but obviously you would be your glance would go through these teeth. If you look at them closer, you would obviously find a lot of these risk factors, which are very common in adolescents, especially with the advent of online food delivery apps. Huge amount of sugar and junk has been consumed by the adolescents, especially uh, right through their teenage years and late night. So there was an interesting study which I was reading, which said that Swiggy and Zomato and the likes of these various online food delivery apps have had increased their revenue greatly by just changing their last delivery time from 10 o'clock to 11 o'clock, and then from 11 o'clock to 2 o'clock in the night, and then thereby delivering through the night. And their revenues have shot up drastically. They have huge amount of revenue. And what will be surprising to note, the 13 to 25 age group is the maximum who is ordering at this hour. So people between the age of 13 to 25 are studying late night and they want a snack. And this is the most common thing which they would order online food, mostly junk, uh, your sugary snacks, your diet has a big challenge. Obviously, oral hygiene then goes for a toss. They do not brush at that point of time, and then they would land up with uh, difficult dental situations which we'll have to treat. Um, Hormonal changes is also very, very common in adolescents, as you all very regularly know. Their irregular dental visits, their fear, their defiance of going to a dentist also shows up because they know that they have cavities and they don't want treatment. Some of them don't like the look of braces and thereby they would want to avoid treatment. And these are the various factors which play into their minds when they are looking at avoiding dental treatment per se. The main prevention which happens and most effective prevention which happens in a child, in an adolescent's mouth, is related to their oral hygiene maintenance, brushing and flossing using water flossers. This is the basic thing which they would be needing to doing. From their end, correcting their diet is something which we will have to also keep reinforcing from your end as well as from our end, that sugar, added sugar is the biggest killer. And then not brushing and maintaining would lead to decay teeth and decayed oral structures. So you need fluoridated toothpaste. We need Pitt and Fisher sealants. These are the two main armamentariums which we have to prevent dental diseases in kids from 6 years to 12 years. When the first molar, the second molar erupts, the teeth, once the tooth erupts into the mouth, for the next 4 years, 3 to 4 years, it's developing. And that is the time when it is greatly prone to decay. In the first 4 years of the life of the tooth in the mouth, when it has not reached its complete maturation, even after eruption, and that is the time when they are prone to decay, and we can intervene at this stage and prevent decay from happening and help the child grow disease free throughout their life. But we need the child to come to us at that age so that we can prevent this decay in their mouth, and then keep reinforcing and counseling with them that diet and dental caries is something which is related. Your twice daily habit of brushing, rinsing your mouth after meals, avoiding frequent snacking, pouching of food. These are certain things which you need to take care so that we can have a healthy oral cavity. Uh, Mouth guard is something which you would hear but rarely see with practitioners not doing so many mouth guards. Sports is a very, very, very common active phenomenon which you see. Active sports in teenagers, there, a lot of them are involved with sports and sporting activities, but hardly any of them get referred to us to for protective sports mouth guard for any kind of contact sports, rugby, riding, horse riding, football, boxing, even swimming for that matter, they need these customized sports guards. So whenever you see a patient who comes to you, for adolescents who come for sports clearances, please refer them to a pediatric dentist who can help them understand the importance of using a sports guard and preventing traumatic dental injuries while they are in contact sports. Uh, these are some things which you will see very, very regularly. You will see crooked teeth, and that's my orthodontist case. So I have his name imprinted there, and he helps us correct align these crooked teeth. This is a standard thing, something which is very, very common with all pediatricians, and now pediatricians understand the importance of maintaining good oral hygiene will also come from the fact that the teeth have to be aligned. Teeth which are crowded will not have an overlap, will not give you adequate space for the brush to reach various corners where food particles get trapped, and thereby they don't get cleaned, and this leads to a huge amount of food accumulation and decay. So thereby, what as the role for the pediatrician would be to recommend a dental checkup once in 6 months, encourage them for preventive treatment, ask them to have more healthy food, more roughage, drink loads and loads of water, and a simple oral examination, which you can do in 30 seconds. Lift the lip examination is very, very popular in infants and younger children. But even if you check the mouth and the oral cavities of teenagers, you will see that if they have brackets or braces, there's a lot of food which is getting stuck in these brackets and braces also. So they should be encouraged to go to their pediatric dentist and get it cleaned regularly, get a cleaning done once in 6 months, once a year, maybe a regular treatment like a cleaning or a scaling or an oral prophylaxis, as it known as, does not damage teeth. Tooth is one of the hardest substance known to human body. It's harder than bone also. Enamel covering is much harder than bone. So while we do a scientific procedure like an oral prophylaxis or scaling, the teeth does not get worn away or get eroded by our instruments. If it does happen, then it doesn't become a scientific procedure. So please refer your kids and encourage your kids to get their regular cleaning done. Everybody on planet Earth will need a cleaning once a year, which you all should get done for your kids because of the simple fact that our saliva secretes a lot of calcium and phosphorus, and the basic prevention for these plaque and tartar accumulation is to just go and get a professional cleaning done once a year. Uh, so my since we are very, very short on time, so I had tried to keep as concise as possible. So the idea to refer is when you see any suspected disease, oral cavity diseases, even systemic diseases many times manifest first into the oral cavity and then systemically. So there are a lot of diseases which we can spot earlier in the child's mouth. Oral ulcers are something teenagers have a lot of stress, a lot of exam stress, school stress, hormonal changes, and they land up with frequent ulcerations that can be well treated and taken care by just guidance, proper guidance. They need to drink lots of water. If they have vitamin deficiencies, you can supplement them with vitamin deficiencies, with vitamin supplements. But the basic idea is if we have proper communication between the pediatrician and the pediatric dentist, I'm sure we would go a long, long way in preventing dental diseases in the adolescent population, which anyways considers themselves to be an adult and yet not adult enough. And they find it very difficult to obey instructions, and it is a challenge for them to take instructions from their parents. When we as doctors guide them properly and try and become their friends, they will definitely be a little more receptive to our communication and probably maintain good oral hygiene, good general health, and take care of their teeth more than what they would be ideally doing right now. And thereby we can prevent loads and loads of dental diseases in such kids. So the prevention has to start early. You as the pediatrician play a very, very vital role. So it's a humble request from all the pediatric dentists across the country and pediatric dentists in your city, your neighborhood, and if not, even general dentists to collaborate and refer them so that they can help these kids remain cavity free, remain disease free, and grow into healthy adults. That's my clinic and the kids who I deal with on a regular basis. I'm open to questions, or as the flow of the event goes, we have panel discussions and we can take questions later. Whichever way, I'm absolutely okay. That's just my contact details. If I'm sure Samik sir is there, so he knows. So thank you all for a very, very patient hearing. Thank you for this opportunity. And I hope we can do wonders with this tricky age group, but I'm sure they're not so difficult if we treat them, handle with care.
What a great talk.
Thank
Very
you, ma'am.
informative. Very informative. Thank you.
Thank you so much, ma'am. Are there any
Thank you,
questions?
Sankalp. Yeah,
Thank you, sir.
Sankalp, I will request you to hang on because we have a panel discussion also,
Okay,
and might be of interest to you, and you may have to come here to you may have something to contribute. We are having quite a few questions for you, but we'll wait for the rest of the sessions to be over before we answer them.
Yes, sir. Yes. Thank you so much.
Professor Sudhir Mishra, I'll request you to kindly introduce Dr. Senthil, and then we can take it from there for the panel discussion.
Thank you, sir. I have already introduced Dr. Senthil and request Dr. Senthil to take over and start the panel discussion.
Yeah, good evening and to everybody. My screen is visible?
Just started.
Yes, sir.
My
It
screen
is visible now, Dr. Senthil. Yes.
Yes,
I'm
sir.
audible.
Please make it full screen.
We also have a youth, I think Sprujana has joined today.
Yes, ma'am.
Okay.
You're there,
Ma'am, we
yes.
also have Karan.
We'll have your questions also, okay? Kindly stay on Sprujana and Dr. Kirti. Yeah, Kiriti.
Hima Bindu, ma'am. Sorry to interrupt, but we also have Karan as youth speaker. He's willing to speak on substance abuse and dental health as well.
Later, yeah. Okay, thank you for all of you.
Later, of course, later.
Yeah, Nomika is also our UNICEF youth lead. Welcome you, Dr. Nomika Khanna. Thank you.
So,
over to you, sir.
Good evening, everybody. Thanks to the chairperson, Dr. Hema Bindu, for giving us the opportunity for this panel discussion. And my respects to Dr. Geeta Patil, the chairperson yesteryear, and the coming year, Dr. Sushma Desai, Secretary, Dr. Prakash, all the Dr. Shamik Ghosh, and all the office bearers, and of course, the guest of honor, Dr. Prashant Sabut, the Vice President of the ESU. So, thanks for the opportunity once again. And we are going for the panel discussion of the common dental issues in adolescents. My panelists will be Dr. Saranya Moni. She's from Coimbatore, an MDS from Manipal, and probably Dr. Sankalp and Moni were together in Manipal.
Yes.
And she's a fellow in interceptive and myofunctional therapy. She's a founder and chief pediatric dentist of Chandra's Little Smiles and chief of the Airway First at Coimbatore. And she's always a topper in MDS, BDS, gold medalist. And of course, over 15 years of experience treating over 3,000 pediatric patients, including 250 children with cleft lip and palate. So she had been in government service in Coimbatore Medical College. And she has the best part is that she is a certified child and adolescent mental health professional. And she has got a postgraduate diploma in child and adolescent mental health in the Pathways Foundation. So she's an experienced and advanced pediatric dental procedures, sedation dentistry, preventive orthodontics, and behavioral management. So she's an exclusive dental practitioner, today's expert, and the other panelists are the senior pediatrician, Dr. Vinay Asava from Howrah. He's a private practitioner, and he's a treasurer of West Bengal Academy of Pediatrics, being the treasurer of the association as well as the forthcoming National Pedicon in 26. And he's a vice president of the West Bengal AHA. Ma. Agila, please. Dr. Shivaprakash Sosale is the associate professor of BMCRI. And he's the executive board member from Karnataka, Central IAP from 2022, and the present EB member. He's a president-elect of Karnataka ID chapter, the national convener of the IAP UG quiz, and is a member of the curriculum committee in ICP. And of course, he's contributed in many modules, and he's been a passionate IAPN. And of course, he's one person very enthusiastic, involved, and he has been in all subspecialty chapters, and his areas of interest are intensive care, infectious diseases, and pulmonology. Dr. Kanya, she is a senior pediatrician from Sigma Hospital, Mysuru, and she's office bearer in IAP Mysuru and AHA Mysuru. And she has finished a Dip and B in pediatrics at CSI Holdsworth Memorial Hospital, Mysuru. So over to the topic, the common dental problems in adolescence. So we are, as the previous speaker, Dr. Sankalp, had told, nowadays the habits of adolescents and lifestyle, food habits, all have been changing. So very well said. And going to the culture of all this Zomato and Swiggy culture, these things have been very, very disturbing of late, but this is the norm today and we have to accept those things. But actually, back to the basics, we should actually have the munching, chewing, grinding in a particular order, in a particular way. We have a saying in Tamil that this body is our temple and the mouth is the entrance of the temple. The oral cavity is the entrance of a temple. Unudambu alayam, ullam perunkoyil, vai gopura vasal. So it is the entrance of the gopura. So the oral cavity is that comes in contact with the food and water. So it has to be dealt in a proper way. So that is how our day-to-day health education and everything has to be more of a preventive aspect. And once the issues come, and of course, I myself, we have also learnt it late. You have to munch it at least minimum 20 times. But nowadays, everything is being swallowed. Everything is being, cooked to the maximum. Either it is very crispy or it is being boiled to the core. So what I feel is nowadays even the deciduous tooth is not falling at 6 years. It takes time. So the munching habit of children and adolescents is very poor nowadays because everything is being cooked. They are not eating like, which can be taken, even fruits can be taken, but that is not being taken. So this is how, in this current perspective, what we are going to do is, here the dentist role is important. So why? Here in this picture you can see. So what is visible is the smile and the tooth that is missing. But we will not see the eyebrow which is weak. So the common dental issues of adolescents, what we face are, yes, sir, are the dental caries, gingivitis, malocclusion, halitosis, trauma, teeth
Dr.
grinding,
Shamik, please mute.
temporomandibular joint issues. Of course, the wisdom teeth and impacted teeth, people are worried about it. See, the adolescents, we face dental issues because of the significant
So please unmute yourself, Senthil, sir. Unmute, sir. Vivek, please allow Dr. Senthil, sir, to unmute. You're able to, sir?
Now I'm audible?
Yes, yes, sir.
Sorry for the disturbance. I'll just share it again. Now it is visible, I think. Is it visible?
Yes, yes.
Yes, sir.
So the adolescents, they face dental issues significant because of the physical and hormonal changes, because sometimes the mandible may be crowded because it may the space may be little. So the crowded teeth can occupy. So many issues, cramping would happen. So of course the hormonal effects will be there. So next slide. I'm not able to move my slide. Okay. So over to Before going to Dr. Saranya, we'll just define dental caries. It is defined as the biofilm mediated, sugar driven, multifactorial disease that results in the phasic demineralization and remineralization of dental hard tissues. So what is the prevalence of dental caries in adolescents? Over to Dr. Saranya.
Very good evening to all the members. And first, before we start with the panel discussion, I would just take 2 minutes to thank every member of IAP AHA. I hope I'm audible enough. Yes.
Yes, please go ahead. Please go ahead.
And I was so surprised with the warm welcome all of you gave, and so many of you coming at this time of the hour to listen to pediatric dentistry lecture. So that is really wonderful. And I would like to thank Dr. Lakshmi Shanti for introducing us to the forum, and Dr. Sendil for really guiding me through the presentation, and most importantly to every pediatrician who had trusted us so far. And I'd worked with the pediatricians in the government medical college and also in and around Coimbatore. So it matters a lot that they are able to trust us for the work we do and refer patients to us. And that collaboration has helped us to expand our care for the adolescents on a whole. So coming to our panel discussion today, so when we talk about the prevalence of dental caries in adolescents, recent times, what we see commonly is that we know that the cause of caries, that usually we call that species as Streptococcus mutans. But mutants has a group of bacteria. That's not just one bacteria, but there are a lot of bacteria clubbed together. We call them as Streptococcus mutants. Recent days, what's happening or what we see more frequently is because of the change in diet and the hormonal pattern, there's one other problem of a mental health issue added along to this combination of adolescence. And the age in adolescence is shifting. That is, a pubertal age is shifting all over the country. It's kind of becoming earlier than what it was before. So what happens here is the prevalence of the caries is now becoming much more commoner and much more in an increased manner. If earlier we had a prevalence list of somewhere around 54% and 45%, and nowadays what do we see is, although the age of the caries happening was earlier somewhere around 8, 9, 10 years, nowadays more and more caries is happening in the 14, 15, 16, 17 years. So like Dr. Sankalp said, it's more because of the access to Swiggy, Zomato, and like Dr. Sendil said, nobody's chewing food anymore. So we are all interested in not chewing food and just gulping out the food. Even fruits, children want to take it as juices. They don't want to chew food or eat food. So the food chewing habit is not there, plus the hormonal thing. So everything is contributing towards that. So this increase, sharp increase in the prevalence of dental caries is what making it difficult for us to access the children. Many times children come to a dental practice, especially the adolescents, for an orthodontic purpose. But they see small cavities. They're not able to identify that they are something going to be bigger, or it's a simple cavity. I've not got pain anymore. There's no sensitivity, so I will not go and visit the dentist now. Or just like that, a neglect. Some adolescents were going into depression, or they have some other anxiety issues. They completely avoid dental care or oral hygiene. So this can be one area where we see that neglect is showing us. It's showing us that they are suffering much more deeper inside. But the oral health is first to identify, like we identify it over there. So, sir, can we go to the next slide?
Dr. Kanya, for you, what is the etiopathogenesis and stages of dental caries? Are you online? Dr. Kanya? Dr. Kanya?
Dr. Kanya was there?
I
You
think
can
she was there.
to the next.
Yeah.
I think you can move on to the next question. I will call her, Dr. Senthil.
Okay, then Dr. Saranya, we can take it.
Yeah. So when we are talking about, am I audible?
Yes.
Yeah. So when we are talking about etiopathogenesis. So normally dental caries is like a cycle. There is a cycle of remineralization and a cycle of demineralization, which is all happening simultaneously. Every time we take sugar in the mouth, so there is a shift in the pH, and the shift in the pH is going to cause a demineralization. And again, when the saliva flows and the ecological shift is coming into a balance, we start to get a remineralization. So this is a cycle, and this keeps happening slowly one by one. But what happens these days is the frequent snacking. So every time we do not give enough time for the remineralization to happen or the restoration of the balance to happen. So the demineralization is more and the remineralization is less. This causes cavity prone. It makes the child cavity prone. So cavity is not happening in one day. When the cavity high risk keeps on happening again and again, every night the child is not brushing. There's a lot of contact time between the food and the and the oral cavity on the saliva. It's not that much during a night time. So all these makes it more prone to a disease. And on top of it, if there is a reason that the saliva is becoming lesser or it is the mouth is becoming more drier, I would say. If there is a mouth breathing or some reason which is again making the oral ecological shift towards demineralization, that is when the problem becomes bad. Continuous demineralization is where the cavity starts. The initial cavities are looking like a white layer on the tooth. So that is a remineralizable stage. If a child is referred at that particular time, we don't even have to cut the tooth and we can remineralize it. There are a lot of options like the toothpaste and tooth mousse is available. But many a times we do not get children at that stage. We get them at a little later stage when the enamel is cut down, like it is gone and there is a cavity. So we cannot replace or regrow an enamel like that, but we can always remineralize it.
She's joined. Kanya is there.
Yeah, I think Dr. Kanya can take over now.
You can join. You take the next question. Next slide.
Kanya, please. Kanya, you can stop the phone. Yeah, please unmute yourself. Yeah, you can go on now.
Am I audible, ma'am?
Yes.
Yeah. Continue. They were calling you.
Yes, ma'am.
So she has dealt with the etiopathogenesis. You can go ahead with this. Or the stages you can go.
Kanya? Yeah.
Is it visible for you? Regarding to know the stages of
yes, please.
Outer coating is the enamel, which is the hardest.
Please switch off your video.
Yeah, video. Switch off your video, then your voice will be audible. Please switch off your video.
Followed by the deeper. Yeah, I have switched off it.
Now it is okay. Please proceed.
Carry on.
Yeah, like coming to the structure of the tooth, the hardest substance is the enamel, which is the covering, followed by the dentin and the inner pulp. So once the enamel gets eroded, the enamel goes away and after in structure, so then it will be a dentin caries. So in the dentin caries, all the symptoms of pain will be more. And after the dentin, it will involve the pulp, which contains the nerves and the blood vessels, which supplies the entire tooth. So once it gets involved, then it is called pulpitis. And for surrounding the cementum and the periodontal tissue, it gets involved in the later stages, where the jaw swelling and all the symptoms of abscess will be seen in a child.
So what are the signs, symptoms, and impact on adolescents?
There's a signal problem.
Yes.
On examination, we can see toothache, which can be mild to moderate and sometimes severe if it gets involved the pulp tissue, pulpitis. So initially they will have the tooth sensitivity to hot and cold objects. Whenever they eat something like ice creams or something like that, then they will have increased sensitivity to the pain. And on examination, we can see a small hole or a pit in the tooth. And because of the poor oral hygiene as well as the dental caries, there can be bad oral breath. And in the later stages, we can see dental abscesses. That will be the collection of pus. There can be some staining of the tooth. So that time we have to recognize and identify that there is some caries. So one more thing is the impact of mental health and on oral health in adolescents. This is a journal which I studied in from the BMC Oral Health. It was a study done to know the association between mental health in suburban Nigeria, where they considered different models to understand the association between these two. So they took the socio-demographic factors mainly. In the socio-demographic factors, they considered age, gender, and the socio-economic status, and the oral health indicators like their brushing tooth, how they brushed, was it twice daily or once, and use of any fluorinated toothpaste, and consumption of refined carbohydrates, and they were utilizing any dental services nearby, or any the kids had any dental anxiety or depression, something like that. And mental health indicators were like smoking, antidepressant drugs, and mental health issues like anxiety and depression, all those things. So they clubbed all these together, and they considered be done to know the association. Even in our OPD practice, we should consider all these things. So the conclusion of this study was like hormonal changes already told, because of the increased surge in the estrogen and progesterone, there will be considerable gingivitis during the adolescence, as well as the cavity formation will be more vulnerable period, and also there'll be increased stress, the problem. And it is a period of increase, like they're more craving for sugar intake and cigarette smoking initiation and all those things. So this can lead to their lifelong oral health issues. So oral health and mental health are like two sides of the same coin. They impact each other. So we have to address their mental health issues to treat the oral health. So we should not separate. So poor oral health can affect one's self-esteem, self-confidence, contributing to their general anxiety and depression. So patients with poor health can neglect their all the factors for integrated mental and oral health care to improve the well-being of the adolescents.
So the effect of caries in adolescence will be physical aspects. We'll have a poor weight gain, chronic asthma, and bacteremia, and a crowded teeth. So this is the physical aspects, and psychological aspects. Because of the low self-esteem, what will be happening is they'll be ridiculed, they'll be bullied, and all sorts of issues will be happening in the school. And so school absenteeism will also be there. So the effect of caries itself can have body image problems. Definitely, the child will be put into stress, and it can put a seed in the child's mind or the adolescent's mind, so that it can later develop into mental health issues also. And of course, the teeth is the organ to munch. So there are physical and psychological aspects. Over to Dr. Saranya. How to know who is at risk?
Yeah, thank you, sir. So this, I feel, is the most important takeaway that I can give every pediatrician who's listening to it. How to do the risk assessment. So there is a basic risk assessment tool that we all have, and not every child require an extensive preventive treatment plan. many times it's the children who are in the high and the moderate risk. We will have to meet them very often or very frequently. So normally, if we see that there are some aspects given by the AAPD. So this is a caries risk assessment tool. So this can be used to identify, is there any clinical condition? Are there any environmental characteristics or a general health condition that is predisposing a child to have a dental caries? So usually children who have any special healthcare needs, those who are in a condition of there is an impaired salivary composition or a salivary flow, those children who have low level caregiver or socioeconomic status, they have frequent meal exposure to simple sugars and suboptimal fluoride. So this suboptimal topical fluoride is like very common because there are many myths about fluoridated toothpaste, and everybody feels a herbal toothpaste is better than a fluoridated toothpaste. So, and there is also areas or demographic areas in our country which have a fluoridated water. So they try to avoid fluoridated toothpaste. But the concept of using a fluoridated toothpaste should never be neglected. 1000 ppm fluoride is very important to each and every child. We want to reinforce that whenever we meet a child or a parent who is in the high risk, especially in the high risk. And now considering our adolescent population, that majority of the children are going towards junk food and they have very ability to be more addicted to sugary foods. So most of the children fall under moderate or high risk. They are not under the low risk category at all. And if they watch TVs or they play games and they are keeping on munching snacks, they're definitely coming under moderate to high risk. So every adolescent, when we are looking into the oral cavity, we have to do the risk assessment. And if they are into these two categories, it's better that we these children get referred by the pediatrician to us. So, and we have a lot of preventive options like Dr. Sankalp had already told us, and like sealants or probiotic, there are remineralizing toothpaste and diet counseling, which plays a very important role. But fluoride varnish is something, it's a very simple procedure, hardly takes 5 minutes in a dental office, and you can get it done every 4 months to do a good prevention for these children in the moderate and high risk categories. So it would be very beneficial for those kids at.
So over to Dr. Vinay. How does dental infection present?
Yeah, good evening, everyone. So dental infections presents commonly as urticaria. If we see urticaria on the face of a child and we find some tooth problem, we should see to it. There are recurrent oral ulcers. There are swelling, lymphadenopathy, and also there might be fever and pain in that area.
So the mechanisms you're telling this, Dr. Vinay?
Yeah. So mechanism linking oral infection to secondary systemic diseases. First is the metastatic infection, microbes gaining entry into the circulatory system. There is metastatic injury, products of bacteria like cytolytic enzymes, exotoxins and endotoxins, and metastatic inflammation caused by immunological injury due to oral organism. Soluble antigen enter the bloodstream from oral route, react with the circulating specific antibodies, and they cause infection.
Over to Dr. Shiva. The dental infections usually have a hide and seek game. What is your take on it? Dr. Shiva?
Yes, sir. Yes, sir. Yes. Very good evening. Thank you for opportunity. Thank you, Dr. Himabindu, madam, and also Dr. Senthil sir for giving this opportunity. This is one of the unusual, unreached, untaught topic. Actually, it's very important. Definitely, you are selected. Hats up to you, sir. So really, it's a need of the hour, and every conference should include this topic. That's my personal opinion. So coming to this infection, dental infection hiding, many times, we always think a subtle infection or a subtle problem is not a major problem. It is not required to address. We always think that. But it is in contrary, many times the infection developed within the pulp of the tooth, so sometimes inside the behind the gums, and also involve the bones also, in the supporting bones also. So they may not manifest as upfront like a very severity kind of things. They may present with some subtle or even absent, and making difficult to recognize sometimes. So suppose sometimes they may be just a dull aching pain in a toothache, maybe sharp or throbbing pain. Only maybe we may come across during a chewing or a biting period. So we'll neglect many times, or a adolescent may neglect. So sensitivity, sometimes when they are drinking the cold water or hot water, or a swelling, maybe gum, cheeks and jaws, mild swelling, even sometimes a lymphadenopathy like this. So these are the things, are mild fevers, they may not be there, or a bad breath. So because of the involvement of the infection, these are all the subtle things actually we usually neglect actually. So we'll consider this is not an important, it's just a routine things in a adolescent age group. But it is in contrary, actually, these are the things should be addressed early, and we should not neglect. And of course, then sometimes the many kids may present with the lymphadenopathy. So even then, when they come with the lymphadenopathy, so then we have to look into the physical signs and symptoms. If there is a physical signs and symptoms are there, definitely we have to investigate, and appropriately and timely we have to intervene for this problem. Suppose if there is no physical pain, physical signs and symptoms, but only just a isolated lymphadenopathy is there, then we can observe, even we can give a course of antibiotic, then we can see for 2 to 3 weeks, and we can observe and see. If it is resolved, then no issue. If it is not resolved, again, it is a time to investigate this, and we have to find out the cause inside the mouth. So oral cavity is a very, very important to know this. So that's how this is a very important treatment also to be managed, depends on that. So if you early identify, many times they may present with only just a discoloration, just a pain during the chewing, all these things we have to send them to the dentist where they can do the various procedure is required, maybe a root canal or antibiotic, maybe an extraction sometimes, so they can be taken over.
So the oral examination is mandatory by the pediatrician. Never underestimate a tooth decay, and decay can be a silent enemy. It can come out in a very, very dangerous way. So over to Dr. Saranya for the first case scenario.
So here we'll talk about a first case scenario where a 12-year-old male child, he reported with extreme pain and mild swelling in the right cheek region, and pain and swelling were there for 3 days, slight increase in the swelling during nighttime, and reported he also came with a mild fever. So he was referred by a pediatrician. There was no medical history, but there was a previous dental history where he had got cavity in the primary teeth. So now we come back to the risk assessment. So any cavity in a primary teeth is also a risk factor for cavity in the permanent teeth. The child also had a hypoplastic molar and incisor teeth. That is, if there is a hypoplastic tooth, again, the child will fall under a high risk category. So, and he had a diet habit of having sugary drinks and chocolates and sticky food, all contributing factors. Every positive finding was there when we spoke to this child. So yeah. So this particular child, so this is the child's intraoral pictures, and we can see that there is a tooth which have a very white frosted appearance. So that is the tooth which had a pain. So this white frosted appearance is an indicator of a hypoplastic tooth, a chalky white tooth. So any tooth which is either brown in color or white, when the tooth is developing only, they are called as hypoplastic. It can be common in molars and incisors. It's called molar incisor hypomineralization. So these children will have a lot of possibility of getting caries easily compared to other kids. And with all the dietary factors contributing, so we did a root canal treatment and also a crown placement for this particular child. So other things what I want to elaborate here are some other features which I was finding it little away from the oral cavity. So there was a temperature, there was an extra oral swelling and a lymph node enlargement on the right side, that is the same side of the mouth. And there was a grade 2 tonsillar enlargement. Apart from this, the child had a low tongue posture. So low tongue posture is also an indicator for a mouth breathing habit. So apart from his food habits, he also had a mild mouth breathing habit. So, and functionally, when we did an assessment, he had a habit of chewing food predominantly on the left side of the face. So this is usually when there is a pain or swelling, children do not complain of pain and swelling in the initial stages. They start chewing food with the other side. So that should be an indicator. They're not using the side where there is a pain. They're starting to use more of a left side. So these are simple signs, but then they will tell us about there is pain, but the child is not able to find out, or there is sensitivity, the child is not able to feel it as pain yet. So there was cavity on multiple teeth, and this particular teeth, it was tender on percussion. That is like if I touch the tooth with the instrument, the child was kind of jumping. So, and there was also a history of night pain. All these were indicators, and they were we were able to diagnose a child with a dentoalveolar abscess. So contributing, the caries being the contributing factor for the abscess. So here we used antibiotics for 5 to 7 days and analgesics. Meanwhile, on the third day of antibiotics, we started with the root canal treatment. We opened the canal, started draining the pus and abscess via the canal. And then after the treatment was complete, we had given a crown for the rehabilitate the particular tooth. And a lot of counseling and preventive protocols were followed after that, so that we want to ensure the child is not going to have any more cavities in the future. Normally, we recommend a 4-month once protocol in the first year visit, and every 6 months in the second year visit, and so on, so that we can have a check on the child's oral health.
What were the antibiotics used here, Dr. Saranya?
Here, because we were suspecting an anaerobic infection, we had used augmentin and metronidazole, two antibiotics. Initially, we started with augmentin, and because the swelling was not going down, I added metronidazole secondly, sir.
Thank you.
And intraorally, while during the root canal treatment, we use irrigants. So irrigants were particularly chlorhexidine and saline we used both.
Thank you. Okay, we'll go to Dr. Vinay. What are the traumatic dental injuries and also the causes and types of these injuries?
So this is the 5th most prevalent injury in the world, but it is most neglected. And when there is an injury occurs, it never involves a single tooth. There are more than one tooth. And it can range from minor crown fractures to severe tooth displacement or avulsions.
Can go, sir.
Because in the adolescence, there are many risk-taking behaviors. There is very much hyperactivity, stress behavior. There is peer pressure. In school, there is overcrowding, inappropriate use of teeth. I've seen adolescent opening cola bottles with their teeth, biting hard items. There is physical abuse. So it's occurs mostly in the home, school, playground, and streets. And there are mainly occurs due to sports injury. There are accidents. There are falls, fighting, adolescent fighting with each other, and accidentally being hit by an object. So these are the causes of traumatic dental injury.
So the sports injuries, accidents and falls and fighting and hitting by an object are becoming very common nowadays. So over to the types, sir.
Yeah. So first is the minor one, only crown fracture, chipping or fracturing of the tooth enamel. Then the fracture goes till the root, which affects the root of the tooth. There is luxation, that is displacement of a tooth from its normal position. And finally, avulsion, which is a complete displacement of a tooth from its socket. And predisposing factor in the adolescents are developmental defects of the teeth, like caries, which causes weakness in the tooth structure, which affects the resistance to fracture, though they are more vulnerable to fractures. And there is mental retardation and epilepsy, which might result in fall of the children and causing trauma to the teeth.
So what are the treatment modalities, and also give a note on prevention?
So early intervention is most important, which is essential to minimize the complication. Then we have to restore. The goal is to restore the function of the teeth and also the aesthetic look of the teeth. Specific treatment is needed, which may depend on the type of the injury and may include root canal therapy, reimplantation of the avulsed teeth, or other procedures. And prevention is, like Dr. Sankal Raj clearly said, mouth guards, they can help the prevent dental injuries, especially in sports. Seat belts and helmets, using seat belts and proper helmet with snugly fitting and the strap tied to the chin in vehicles and bicycles can minimize the dental injuries during accidents. And awareness and prevention and understanding the risk and prompting protective measures can help prevent dental trauma.
So what do you conclude?
The conclusion is
In short.
traumatic dental injuries have become a major public health and dental problem. It is a traumatic experience, not only for the child, but also to the parents. It is not only physical, but also emotional and psychological. Prevention and treatment of traumatic dental injuries should be emphasized to the public, the health professional, and the policymakers. The most ignored aspect of traumatic dental injury is the patient's mental health concerns, which we have discussed earlier. Like loss of a tooth often results in a compromised psychological condition. And it is also important to have proper documentation, not only for medical legal purpose, but also to have a baseline reference regarding the traumatic dental injury.
So the case scenario, second one to Dr. Saranya. Over to you.
Yeah, this particular child, like doctor said, he had come from a bicycle accident and there was a broken tooth fragment. He's a 15-year-old male. And when he reported to us, he was reporting from a pediatrician's office as well. They had given me a call, and over the phone, we had instructed him to bring the broken piece along. So either you store the broken piece into the oral cavity. If it's a bigger person, like an older person, we would instruct that. But for a child, we didn't want to risk it. So we asked the patient to bring it in either cold milk, or if you have tender coconut water near you, just bring the tooth in that. So very well guided. And after the first aid and examination by the physician, so he came to our office and he had other extraoral injuries, like there was a laceration on the face and the lips. But all jaw movements were normal. There was no pain while he was opening or closing, moving the mouth, and no hematoma or any fracture of the condyle, nothing was noted. Occlusion was not deranged. So we eliminated all the other possibilities of any trauma to the bone structure. And we found, finally concluded that it was just a tooth fracture, and it isolated to the mobility of a tooth was there, and there was a fragment available. Okay. So can we have the... So this was a fragment reattachment procedure that we did for this particular child. Since they brought the tooth in the milk, we then washed it in the saline and then into our chlorhexidine or whatever like liquids are available in our clinic, which is necessary to condition the tooth to be there into the oral cavity. So after doing this, we were able to reattach the same fragment that the child had broken. So many a times the referral is happening, but they do not come with the fragment or the tooth in the hand. So we really recommend that the tooth and the fragment, whatever is available, just bring it to us. If it is possible, we can definitely reattach the same tooth for the child rather than creating an artificial tooth. And the life expectancy of this kind of procedure is usually 5 to 10 years when they rightly use the anterior teeth. And we also have case studies where more than 15 years the tooth can survive without any much of a problem. So this is one case. And I also want to talk about, and the fracture was called as an Ellis class 2 fracture. So like a crown fracture, and we use an X-ray to rule out that there is no fracture in the root. Usually we follow IADT protocol whenever there is a traumatic dental injury. So any tooth fragment, if it's a crown fracture, root fracture, or crown and root fracture, multiple fractures, we have a lot of protocols there. So we just follow that, and it's evidence-based. So we get really good outcomes out of it. And when an avulsion happens, always try to replant the tooth whenever possible. If a child comes to a pediatrician's office, most likely they'll go to a pediatrician's office and not to a dentist's office. So when an avulsion happens, we recommend to hold by the crown, just ward the root of any debris that is there, wash it off, and then put the tooth back into the socket, hold it with a slight cotton, like slight pressure, if that is possible or practical. If that's not practical, you can either hold it in the oral cavity, and even if that cannot be done, we can use like tender coconut water or cold milk to preserve the tooth. And the most important thing is we need to follow the rule of the golden hour. That is, within an hour, we have to try to replant the tooth back into the socket for the best outcome and results. And the pediatrician can definitely do this and send the patient, and we will do the fixations. That we can do it later on.
So is gingival inflammation common in adolescents, Dr. Kanya?
Yes, sir. Because of the hormonal variations, as we already told, like increase the surge in the estrogen and progesterone, there will be gingival inflammation. That's why there will be gingivitis. And so it can be associated with the dental biofilm alone or mediated by systemic or the local risk factors. Sometimes drugs also can influence in the gingival enlargement, like phenytoin and other drugs. So in case of recurrent caries also, they can have recurrent gum bleeds and gingival inflammation. So the causes, so that the treatment for the causes for the recurrent gingivitis is because of the neglected oral hygiene, or sleeping late during the night, or as already said, it is late night snacking without brushing the teeth, and hormonal imbalances during the adolescent period, which is more common, and mouth breathing, again because of some malocclusion or adenoid hypertrophy or tonsil hypertrophy, they can have mouth breathing, or in case of obstructive sleep apnea, they can have mouth breathing. Sometimes in case of tooth eruption time and plaque and the tartar formation during the caries, and drugs, sometimes if there are any on antidepressants which can reduce the salivary production, that they also can cause caries and gingival inflammation. So they usually present with the caries formation and all those things. So basically they have to do a good oral hygiene at home by doing a proper gum massage before or after brushing the teeth, and they have to eat like less sugary items and less carbohydrate, so that because the sugar, once it comes into contact with the bacteria, it will form a dextran, and the bacteria will directly form a plaque formation over the gut, over the tooth surface. So, and we have to also see that the child consumes adequate amount of vitamin C, which is very much essential for the gums, and should look for any anemia and hormonal disturbances because of recurrent gum bleeding. And these are all precautions to be taken.
Over to Dr. Shiva. You can tell us about the malocclusion of teeth.
Again, we'll come to the malocclusion. Many times we'll think that occlusion is a problem. Actually, the occlusion of the upper teeth, that is the maxillary and the mandibular teeth, is actually should happen properly. If anything's abnormal occlusion, so maybe because of the overbite or underbite or a cross bite or kind of things, if they are not contacting properly or not aligning properly, then it is called as a malocclusions. This malocclusion is many type is there. So number one is actually the intra-arch occlusion, or maybe an extra arch occlusion. So intra-arch occlusion may be a single arch occlusions can occur, spacing many times different occlusions occurs. Others, even inter-arch occlusion also can occur, inter-occlusion, arch occlusion. If you ask what is the causes, many times in hereditary, so maybe a possibility of congenital because of the craniofacial abnormality, syndromic, all these things may present. Or either maybe because of the habits like a thumb sucking or a finger sucking, many times a tongue thrusting, or a lips matching, lips biting, nail biting. These are the problem, trauma, or some congenital abnormalities. These are the common causes for the malocclusions. So as everyone knows that the psychosocial development of any individual adolescent is mainly highly determined by the facial aesthetics. For the most common determinants of the facial aesthetic is the teeth. So of course, the teeth is the one of the important that influence the smile, laugh, speech, and everything, and the beauty, and also personality. Everything's will be determined by that. So the proper occlusions should be identified early. So these are the common causes. We have seen that there is a cross bite, open bite kind of type of malocclusions because of the thumb suckings. Thumb sucking we have seen many times 10, 12 years, up to 12 years also. So these are the malalignment can occur. So that leads to even a facial distortion of the facial aesthetics, and also many problems like tooth decay caries can occur because of the poor oral hygiene, or difficult to maintain the good oral hygiene, or it may be causes even a periodontal disease also because of the hygiene problem. Sometimes because of this oocyte problems, it may cause even a trauma also. So they cause all also malnutrition because of the mastication problem. Sometimes it's very difficult to eat the food or chew the food, or maybe sometimes very difficult to speak also, or maybe sometimes tooth impaction, or sometimes sleep apnea, or some definitely everything leads to reduce the self-esteem, self-confidence, and other psychosocial issues also will cause us this problem because of the malocclusions. So another is they say ugly duckling. The stage is called, it's an early stage where we come across the both the stages of the temporary and the permanent tooth eruption. Usually we see in the age of 7 to 12. So the early duckling comes temporarily. These are the things, it is normal. Actually, in this age, it is normal. But as the in adolescent ages reaches, we have to be make sure that it should be corrected as early as possible, and we have to find out the risk factor involved to correct it. So when to treat? So we can treat the as early as possible once the permanent tooth erupts. Like orthodontists can often address the malocclusion more effectively. So we have to at least, what is our role as a pediatrician is, usually we overlook these malocclusions. So we'll not bother much. So otherwise we'll think that it is normal anyway, you can take care in future. So that is the things we have to aware this, and we have to refer these patients to the for the early recognition and early interventions, so that the proper jaw alignment and other permanent tooths can be done. Otherwise, in adolescent treatment also they can do that. Even adult also they'll do. So very many aesthetics, prosthetic things are available. So removable orthodontic appliances or fixed orthodontic appliances. I think Madam can tell, Saranya Madam, and clear aligners. Many things are available actually. So only thing is awareness. These are the available. So we have to correct. We have to identify, and timely it has to be intervened. For the intervention, we have to early referral should be done. So that is the message we wanted to give. So what is the benefits is the longevity of teeth, like of course, cosmetically aesthetic, facial aesthetics will be maintained. It gives the self-confidence, self-esteem is very important in adolescents, age group, and dental and of course the mental health. These are the benefits of early intervention of the malocclusions. So what is the message is malocclusion is very common. We should not neglect this. We have to refer to the pediatric dentist for the early intervention and proper intervention.
So, Dr. Saranya,
Yeah.
I think we are running short of time. So you quickly wind up with this third case scenario, please.
So this third case is about a child. Yeah. It's about 11-year-old female child. Basically, the child had reported us with an improper tooth, and they had a mouth breathing habit, snoring habit, tongue thrusting habit, bruxism, poor sleep, and bedwetting. So these are very relevant in this particular case. The next slide. Sir, can we go to the next slide?
Senthil, sir, yeah. Next.
Yeah, so in our examination, we found that there were all the planes when we draw it, there was a lower facial height. This was improper. It was not in balance. Can go to the next slide, sir? So these were the functional assessment that we did on the child, and we found that low tongue posture, hyperactive mentalis, there was a unilateral chewing, TMJ clicking, and a high arch palate. Next slide, sir. So you can see that there was a underbite, like sir said, that was a cross bite. Next slide, sir. So basically here I want to stress on the lateral cephalograms that we take. They always give us an idea about the adenotonsillar shadow and the deviated nasal septum or the turbinates. So we are able to see these extra aspects which are the root cause of the malocclusion. And unless the root cause is treated, we do not get a very good outcome. So for this particular child, an ENT evaluation was done, pediatric sleep questionnaire was given, and we found out the child had a sleep disordered breathing. A functional evaluation was done, and after a collaborative effort, we came up with a diagnosis of bilateral maxillary skeletal crossbite and sleep disordered breathing. So our treatment plan was to start with the oromyofunctional therapy. So the therapy mainly aims at three things: that your lips should be closed all the time, the tongue has to sit on the palate whenever the child is not using the tongue in the end spot, and the breathing has to be through the nose and not through the mouth. So this and rapid maxillary expansion was done, following which we did an orthodontic therapy for the alignment. So in this particular child, the referral was early, so we were able to do a lot of good things for them. And earlier, Dr. Shivaprakash said that we are able to treat dental malocclusion at a later age as well. But then growing the jaws, we are able to do it only when the child is younger. So the earlier we get referrals, we can do orthodontic treatment without extraction of the 4 premolars. And once we do the 4 premolar extraction, our jaw goes back and it affects the airways. So overall, the health improves when we are able to do early treatment and identify the root cause. So this is a very favorite slide of mine. We don't see the things the way they are, and we see the way we are. I hope today we all start seeing things a little differently and approach the pediatric dental aspect and pediatrics, that they go hand in hand, hand in glove approach. And there is definitely a dental and mental health continuum. And I hope we are able to address that in a united front. Thank you.
Thank you so much, Dr. Saranya. I think the adolescents also want to say the same thing. They want them to see in their way and respond to their needs. So let us make a dent in dentistry. So thanks all the panelists for their wonderful cooperation, and they have done so excellently. Thank you so much. Thank you. Nandri Vanakkam.
Thank you, sir. Senthil sir, I request all of you to kindly stay on to hear our voice of the youth. And yeah, please, all the specialists kindly stay on. And they may require your suggestions. And now I would quickly introduce our youth moderator, Dr. A.S. Kiriti. He's a professor of pediatrics from SV Medical College, Tirupati, Andhra Pradesh. He is actually graduated. Namaste, Dr. Kiriti. He's an undergraduate and PG from SV Medical College, Tirupati. And he's been the secretary of the Tirupati branch long in 1618, 2 years. Later, he has escalated to take up the responsibility as secretary of the IAP AP State 23-24, and has also been the secretary of the NNF AP State. He's vice president of NNF AP, and he had a lot of publications, both national, international. He's been a very aggressive, sincere facilitator, both in ALS and NRP programs, and has also represented Andhra Pradesh in Central Executive Board of Central IAP. You are, I think, is a wonderful human being, I would say, and the very, very sincere pediatrician, and now he's leading the medical college at Tirupati Government Medical College. Welcome you, Dr. Kiriti. And now I request you to please introduce your youth. I think there is Dr. Sprujana, and Naumika from Khanna is also joined from UNICEF, and one more youth, Karan, na?
Ma'am, Karan.
Karan, maybe all three of you can. Yeah, Karan, can we see you with the video on? And I leave the Kiriti for the floor for a candid conversation with our youth. I think Sprujana is ready with his questions. The others can also pitch in. Yeah, Kiriti, over to you.
Thank you, madam. Thank you for giving me the opportunity to share on this wonderful platform. I thank Dr. Shivamindu Singh and Geeta Patil ma'am and Dr. Sendil sir and other eminent people on the panel, and Prakash Veer Arya sir. So actually, we come across with so many youth people. We got the queries we collected all the queries from the youth people, and regarding the dental health and cosmetic issues, and we consolidate all the questions and pile up and pull into 12 segments. Like first, general health, dental health and tooth decay and cavities, orthodontic and alignment issues. Like that, we segmented into the 12 segments. So, Srujana, I would like to introduce my Srujana, and other youth people are there.
Yeah, they have joined. Karan and Naumika
Karan.
from
Yes,
UNICEF. Welcome you. Sprujana,
Sprujana?
she's our AHA Youth Forum, the one who's initiated it. Sprujana.
Yes.
Thank you, ma'am. And before I begin with asking a few questions, I would say it was such an informative section which provided us a lot of insights into the dental health and all. So the panel discussions and the lectures were really useful, and I think all the youth must be aware of all of this.
Sujana?
Uh,
Sujana? Am I audible?
hello?
Let us go to youth voice. Huh? Okay. There is
Sir, am I audible
one
now?
of my yes, ma'am. Yes, Sujana. There is one of my youth friend Rakesh is very super busy with the school and sports, and he does not always brush twice a day as advised by the Vedanta dentist. So do you want to any issue with this, Sujana?
Uh, yes, sir. So what can be the easiest way for him to keep his teeth healthy without actually spending too much time on it? Because
Yes.
a school-going kid and all usually don't find their way and taking care. So
Yes.
She has a question back to you. Without
No,
wasting time, they want to
it's
keep.
because we'll ask the panelists, any experts
Yeah.
on the forum, they will answer these questions, ma'am.
Yes,
Sujana?
yes. Without wasting time, they want to keep their teeth clean.
Yes.
Ma'am, if you allow, I will
Yes,
get back
yes,
to
sir.
that.
Right.
So,
Yes, Shankar. Yeah, please. Go
yeah.
ahead, Shankar.
The basic idea which we would recommend you to do is twice daily brushing, rinsing your mouth after every meal, limiting your snacking and sugar intake to a bare minimum. And if you have crooked, malaligned teeth or not in line and crowded teeth and food particles get lodged in between, frequently if you have that issue, then use water floss or floss basically, and routine dental checkup once in 6 months. Clean your tongue morning and night after brushing. And the last thing you do at night after brushing is to go to bed and not snack again after that. So those are basic things which you should keep in mind, I think. Dr. Saranya, if you can add anything.
I think there is
Yes.
no shortcuts.
The easiest way. So she was asking for the easiest way. Maybe I will add a mouthwash there.
Okay.
Yeah.
One of my friend's daughter, Archana, drinks a lot of soda and energy drinks with her friends.
So, ma'am, is it actually bad for her teeth, and what can she drink instead that won't mess her up with the hygiene?
So I think Dr. Sankalp will clarify this.
Any sugary drink, if you look at all the aerated, carbonated soda drinks, sugary drinks, they have tons and tons of sugar. And all the aerated drinks, in addition, will have a lot of soda, or basically it is acid. An acid attack on the tooth will, our teeth is made up of mineral. To dissolve mineral, you need acid. So your any sugary drink is dissolving tooth structure by the acid attack. So it is very, very important that we avoid this acid attack and reduce our sugar drink. In case you're taking sugary drinks and you want to take some soda once in a while, use a straw to instead of directly consuming from the glass. You can use a straw. The straw helps you avoid the tooth structure, and you can go to the throat level while you are using your sugary drinks. And rinse your mouth well after you've consumed uh, these kind of drinks, in case you are consuming them.
Thank
To
you, sir.
add to that, that sugary drinks, no, Sprunjana, it also messes up with your head. So sugar is very addictive, right? Every time you take
Yeah.
a sugary drink, and next day, almost at the same time, your brain would want another a dose of sugar like that. So in a longer run, it's better to cut out sugar in the form of a drink or any other snack for your overall health, gut health. There's so many relations there, correlations there.
Definitely, ma'am.
Yes. Okay. Yeah, one more friend, by name Rajani. She never been to dentist because he's always nervous about it. But the
So
panel says
actually,
regular dentist visit is must. But yes, Prajana.
so how often is it advisable, sir? And what happens if we actually skip those checkups and all?
Once in 6 months, I think you can take out time to go to a dentist. I think that's bare minimum. Just once in 6 months. It's
Oh,
not too much of a task. Our mouth is one of the most abused zones of the body. Uh, and we think just by once a day. Honestly, I mean, how many of us, how many of patients, our patients brush twice a day? Teenagers, forget teenagers, adults, they don't even brush twice a day. So by once a day brushing, we are expecting that we will keep this oral cavity clean, hygienic, healthy is too much to ask with that 2 minute brushing. I don't think so. We do 2 minute brushing also. Even that morning when you're brushing once a day, that brushing also doesn't last more than 15-20 seconds for a lot of the teenagers or adolescents and even kids. Adults land up brushing maybe slightly more to say 40 seconds, but the average would not be more than, and you require a basic 1.5 to 2 minutes to brush properly, clean your mouth. So, unfortunately, I don't know of a shortcut, but twice daily brushing is something which you should inculcate, and 6 monthly one dental checkup. If you've got fairly good oral hygiene, then 6 monthly.
Yeah, twice daily brushing the teeth, at least minimum for 2 minutes. Once in 2 months, change the brush. And of course, twice in a year, you have to go for a checkup, all two.
so rule of two. Okay, sir.
All of you.
So this
And there
this
are
about
brushes,
general good.
sorry, and there are brushes which have incorporated timers into them. So you can know that there are 2 minutes of brushing done. All the
Yes, yes.
mechanical toothpaste, so the toothbrushes have timers.
How
You can
much
use
time
timers.
does Karan spend on brushing?
And I spend about 2-3 minutes.
Honest.
Yeah, about 2-3 minutes. Yeah.
Yeah. Okay.
2 minutes.
Coming
Now
back
you
to
can
Kiriti.
remember to rule of two.
Kiriti, over to you.
Yes, yes, ma'am. Okay, coming to after general dental health, we go to tooth decay and cavities. One of my friend Amit got a cavity last year, and he is worried he might have another one because his tooth hurts sometimes.
So now the topic is about tooth decay and cavities. Talking of which, I think almost every other child out there has this sweet tooth and cravings for chocolates and all. So definitely because of that, the cavity issue raises up. So how can he tell if he has a cavity and what do you do to fix it, sir?
Yeah. Again, your once a year or at least once in 6 months, twice a year, if you get your dental checkup done, the dentist will tell you if you have a cavity. In case you land up having a cavity, do not neglect it, get it treated. The idea behind it is once you have a cavity, it is irreversible. Okay, dental decay only in its incipient stage, when it is starting to show signs of decay, it shows some white spots on the teeth, and they may be reversible using some remineralization pastes. Once a frank cavity or a breakdown of the tooth structure happens, then the disease is irreversible. Now, dental decay has three characteristics which we all should very, very clearly remember. Dental decay, number one, is irreversible, as I told you. Number two is slowly progressing. That means once it starts progressing from the enamel to cross through dentine and to get to the pulp, it might take 6-8 months, maybe a year. But at the same time, it is rapidly spreading. That's the third characteristic. That means from one teeth to two to four, four to eight, within no time your whole mouth will be full of cavity, because bacteria houses in that tooth structure, and from there they get the nutrition from the sugary drinks which you are, or sugary chocolates or sugar what you are consuming. Even a regular food then acts, if it gets lodged there. From there the bacteria breaks down the tooth surface and causes a frank cavity, and it becomes a house of bacteria from where the party begins, and they spread all over the mouth, decaying the entire oral cavity, the number of teeth in your mouth very, very fast. So thereby, if you've got a cavity and you're already getting sensitivity, that means you have crossed the enamel barrier, your enamel is broken down, and the cavity has progressed into dentine. The dentine is the second layer or the middle layer of the tooth, where there are nerve endings, and those nerve endings make you feel extremely sensitive, especially when you have an ice cream, something very hot, something very cold, you'll start feeling those sensations. That means it's already gone to the second layer of the tooth. And it's, if that's not the alarm, our body is beautifully made. So these alarm bells are already coming time and again to us. It's just that we keep putting it on snooze mode, and at some point we realize we're already late and we're then rushing.
Yes, sir. Thank you, sir.
To add to that, sir, there are self-examination options. Like you can just look at your mouth into the mirror whenever you're doing the brushing. Make sure the food particles are not there after you finish brushing. Recently, there are apps where like you can put your picture of your tooth into the app. App will guide you to understand that if there's a cavity. So that is also a possibility with AI coming up. No, so you can.
And with any black darkened spot on the tooth which you brush and doesn't get removed, or it doesn't go away, that's not a food particle, that's a cavity already developing. I mean, if you see, and your back tooth, especially if you observe, they all have grooves, and these grooves are food traps. So these grooves have to be cleaned well. If you see some spot for 2 or 3 days and it's not going away, you just go to a dentist, get a checkup done, and probably you'll know that there was a cavity developing. Once it's cleaned and filled, normally it's a very minimally invasive procedure. So you hardly take any time, and that's sorted for you. You've removed the house of bacteria from there, so the disease won't start. It has to, the bacteria have to start all over again to again cause disease, which will take more time. Otherwise, this will be a lot faster if you leave them there.
One more friend is there, sir. Sneha loves eating candy and snacks, especially late in night, as you said already. Does that cause any cavities? Can any toothpaste can prevent that cavity, sir? This is a doubt by Sneha.
Fluoride is what is there in all our toothpaste, and it is recommended that 1000 ppm minimum fluoride should be present in our toothpaste when we are brushing. There's a huge myth against fluoride, or um, uh, I would say misconception more about fluoride, that fluoride will cause fluorosis and fluoride will cause disease, brittle bones and all of that. Fluoride in the toothpaste is useful for the local application only. It's not for systemic consumption. It is local application, and daily local application of fluoride on your teeth through the toothpaste is very helpful in strengthening the tooth structure against decay when we compare. But if you're snacking too much and you're not brushing or not doing after that, then it's very difficult for the toothpaste only to help you. You need to also change your dietary patterns and habit.
Thank
So,
you,
Thank you.
Kiriti.
There is a query from Naumika Khanna.
Yeah, Naumika and Karan have some queries. I
Yes.
think about staining of teeth, and when there's especially substance abuse, smoking, and they are very conscious, right? So yeah, Karan, you want to interact first?
Naumika.
Karan?
Hello.
Unmute, yeah.
Yeah, ma'am. So my name is Tanvi. So I just want to say a few things. As a young person, I believe it's crucial to understand how substance abuse can severely impact our dental health, especially during adolescence when our bodies and teeth are still developing. While many people, you can hear me, right, ma'am?
yes, we.
Yes.
While many people associate substance abuse with physical or mental health issues, its damage to oral health is often overlooked, yet incredibly significant. Tobacco products, including cigarettes and smokeless tobacco, are some of the most harmful substances for our mouths. Smoking stains our teeth, causes persistent bad breath, and weakens the gums. Over time, it can lead to severe gum disease, tooth loss, and even oral cancer. Chewing tobacco is no better. It causes aberrations on the gums and dramatically increases the risk of mouth sores and cancerous lesions. Alcohol is another common substance that affects dental health. It dries out the mouth, which reduces the natural flow of saliva. Saliva plays a key role in protecting our teeth by washing away food particles and neutralizing acids. Without enough of it, bacteria can multiply quickly, leading to cavities, gum disease, and tooth erosion. Many alcohol drinks are also acidic and sugary, which worsens the damage. Illicit drugs like methamphetamines, cocaine, and opioids are even more destructive. Meth use, for instance, is notorious for causing meth mouth, a condition involving extreme tooth decay, cracked enamel, and severe gum infection. These substances not only reduce saliva and damage tooth structure, but also alter judgment, making people neglect basic oral hygiene. Substance abuse during adolescence has long-lasting effects, and dental health is no exception. A healthy smile reflects overall well-being, confidence, and self-respect. Instead of risking irreversible damage, we should choose habits that support our growth and protect our future. Saying no to harmful substance is one of the most powerful steps we can take to preserve our dental health and overall health. Thank you.
Thank you, Karan. That was so good on part of the youth to say and how it damages and how if you take leads for a change, there's nothing like that. Yeah.
Yes, ma'am.
Kiriti, any more questions?
Yes. Yes, ma'am.
Quickly, yeah. Mika also wants to say something, maybe. Yeah, you can finish first yours, Kiriti.
Yes, ma'am. Rahul's friend said the fillings looks weird and hurt a lot, it says. Is it true, sir? Filling of the cavities.
What he says?
Looks weird.
Filling of cavities. Any hurt? And does it cause any hurt to
Does
the?
it cause any pain?
Yes, pain or hurt. Yes, yes.
No.
No fillings. When we are doing the cavity preparation, if the cavity is in the dentine or the second layer, then there may be some sensations, but that's only transient, only during the procedure. And most of modern clinics are equipment, nitrous oxide, oxygen sedations, and various forms of treatment, which we can make it as painless as comfortable as possible. However, said that, there is a perception which people have that cavities and fillings are difficult to treat and they're very, very painful. Pain always indicates an advanced stage of the disease. So if you go in to a dental clinic late, then you come require use of local anesthetics and injections, which may lead to some amount of pain and discomfort at some point of time. But fillings are not painful. Dr.
Dr.
Saranya, would you
Kiriti,
like?
we need a rapid fire question answers in the last 2 minutes. You can just fire rapidly now. Say
Okay.
anything.
One of my friend's daughter, Priya, feels embarrassed smiling selfies because his teeth are crooked. So does he needs any braces, sir?
Yes, orthodontics will help them, definitely.
And one of my friend's son got a Invisalign. He said
Invisalign. Yes,
Invisalign. So
Invisalign.
what is it, sir? Any throw a light on that,
It's a
sir?
modern technology where braces is no longer used, and science has advanced to such a stage that almost invisible braces is there. It's a use of AI software and technology to move teeth within the jaws using plastic trays, a sequence of plastic trays backed by proper science, where we can move teeth through the jaws like the traditional braces, but without braces actually being visible on the mouth. And you can easily get them treated. And your local dentist or pediatric dentist, they all will have teams providing you Invisalign.
So one of the friend Arav's, his teeth is yellow, sir. So that's why he's worried about his color, sir, the teeth color. So he wants to know about this any whitening of the teeth or anything is there to whiten his teeth.
I think sir is
Cosmetic.
stuck up. Can I answer this?
Yes, ma'am. Yes, ma'am.
Yeah.
Quickly.
Yeah, whitening of teeth is not mostly required for adolescents. Yellowing can be also because of calculus. So a simple cleaning and polishing should help him. Beyond that, whitening or reducing 1 or 2 shades with all the strips, we do not recommend. If it's a dental office whitening, that is more controlled.
Madam, one more question, madam. Rohan chipped his front tooth when he fell on a skateboard, ma'am, and it looks weird now. Can you fix the chipped tooth so that it looks nice?
Yes. So the one discussion where we showed a fragment reattachment, but if the fragment is not available, we have a material called as composite, very much matching the tooth color, and different shades are available. So we can make an artificial filling which is in the same color of teeth, or a crown, or a full coverage crown. So it gives a very beautiful appearance. There's something called veneers as well. So we can choose from multiple options.
Spruti, you can ask some more questions. Srujana.
Monica, yes.
Yes, sir.
Namika.
So, ma'am, to be very quick, can you give us a few insights about the teeth gaps and gum bleeding?
Gaps, see, if there are gaps in your tooth, which is particularly after all the tooth has erupted, that's where the role of Invisalign comes in, and you can kind of move the tooth without use of much of orthodontic treatment. But in a developing child, if there are gaps in between the teeth, so we need to identify two things. Are there any root cause for it? That is the tongue coming in between the teeth, like this every time the child is swallowing, or there is a mouth breathing habit. If there are no habits like that, when we move ahead with orthodontics, or how to reduce that possibility and bring the teeth back together. Sometimes even the lips, there is a tissue called frenum. So it can go in between the teeth, and that can cause a gap. So frenectomy, a simple procedure like a frenectomy, hardly takes 20 minutes of time, and that should help you get rid of that condition.
And yes, ma'am. And one last thing, there is always this false notion of all the dental treatments being very expensive. So it usually comes as a concern of families where they don't have a lot of money and they're being worried about it. So can you just give an alternate cheaper ways or something regarding this?
No,
So they don't
actually,
feel.
this is a very common notion, but then dental
Yes.
treatment is not
Little louder,
expensive.
Saranya.
Can you hear me now, ma'am?
Yeah.
So dental treatment is not expensive. I think the delay is expensive. So the earlier you come to do all preventive treatments, they do not cost you much at all. So hardly a few thousand or thousand, within thousand also sometimes. But the intervention treatments, that is the root canals, the crowns, that is at the later stages, whatever you come, that is where the costing becomes problem. But then if the sterilization is really good and the person who's offering you the treatment is really good, they are going to charge a little more than the others. But I won't say it is that expensive that you cannot get it done at all. Not like that. That's a myth, actually.
So not to waste money, go early.
Go early.
If you want to really
Got it.
save money.
Yeah.
Save money, go
If you
early.
think there's a saying that if you think dentistry is expensive, try being a dentally neglect patient, and then you'll realize what expensive is. So do not neglect your dental hygiene. Take care of it, and it's definitely, as Saranya said, a few thousands, which you might land up spending in the entire year. I think Nomika has been
Namika is
wanting
waiting
to.
for some time. Yeah.
Yes. Good late night, everyone. So I'm a youth champion from UNICEF, and I would like to talk maybe a paragraph because of the shortage of time, and also pose a question to all the doctors. So if anybody can answer, do answer. So I would like to start by saying that a coin has two sides, just like every choice we make. On one side, there's a thrill, the pressure, the illusion that why won't we just try the substance abuse? On the other side, we know the bad side of the substance abuse, that it can leave a lasting scar, especially on our teeth, especially on dental health, something which most of the adolescents don't often think to. So, most often as a young child and as a young person, I navigate through adolescence, just like Karan told that various substance abuse and all of these elements. I've seen how peer pressure, stress, curiosity can move towards various harmful substances of one individual. But as we rarely hear this, how deeply it can affect something as personal and visible is our smile. Our teeth aren't just for chewing food. We are not cows. They are part of how we express joy, speak confidence, and connect with others, just like I'm connecting to you people. When substance abuse creeps in, all of this poses as a risk. Smoking dulls our smile with yellow stains and horrible stains on our mouth also. Also, so the effects of alcohol and methamphetamine, like Karan, elaborated, and the use of chewing tobacco, which is very common in India across a number of regions. Also, imagine hiding a smile because you're ashamed of what happened to it, because of the regret, and struggling to eat or laugh or speak. Our adolescence is very important. In fact, all of us, like all three of us said that our adolescence is a chapter of growth, dreams, and finding our voice. We deserve to face the world with confidence, pride, and with a smile, with equity, and without the burden of damage. So we should be aware when this coin is in the air, and educated, aware, and amplify the voices as adolescents itself, thinking twice before choosing the side that would cost our smile. That is one without substance abuse and the one with substance abuse. Your health and your happiness. Choose yourself, choose health, and choose to say no to substance abuse. Now, my last question to all the doctors is, for example, I know somebody who takes oxcarbazepine or phenobarbital. I think you all know about these salts. Do these salts have some negative effects on the teeth of the particular individual? I would like you to answer these questions.
Yes. Long-standing use. Kiriti, I think you're as a pediatrician.
Rather than phenytoin can cause gum hyperplasia and all that.
Yeah, phenytoin.
Not the phenobarbital.
Yes.
Thank you so much.
I have a very interesting case of I came across one very recently. The children who are using cool lip. So you know that smokeless tobacco, which they use it, that's becoming very common in our locality. And in the
It's
oral
called
cavity,
vaping.
yeah, not vaping. There is a cool lip,
Not vaping.
like
This is cool lip.
yeah, smokeless tobacco in the form of something like you put it in the mouth, pouch it in the mouth. So there are oral changes. So when you see the oral cavity, there's something like first stages of cancer, like leukoplegia, erythroplakia. So that's common as well. So probably when they get educated, they may not like to try those things for the short-term gains, probably.
That's what I said, that as adolescents, like Sprijna, Karan listed out, that all of us, they do pointed out the concerns, but at last, we also need to know the effective measures. And for knowing the effective measures, we need to have awareness at all the levels. And this webinar, even though it's a small change, is a change towards adolescents, because we are going to tell others that, okay, I attended this webinar and we need to stop substance abuse, because we knew from all the doctors, from the horse's point of view, And thank you so much,
Definitely.
doctors, for spending such amount of time and highlighting so much amount of biopsychosocial aspects. I will definitely be thankful from the depths of my heart. Thank you
Thank
so
you,
much.
Namika. That was
Definitely.
one
It was
platform. Yeah,
it was
Srujana.
such an informative session that it provided us a lot of insights into the dental hygiene, which we're gonna actually practice and gonna preach to all our other colleagues and our friends. Definitely. Thank you so much, everyone.
Thank you.
And
Thank
one
you.
last question on flossing, sir.
Yes, sir.
So there are a lot of controversy in the flossing, whether it is required for all the people to do flossing or any recommendation for flossing, sir.
So you want an honest answer or a politically correct answer?
It should be useful for the youth, sir.
We want both.
I think if you so the honest answer is the politically correct answer is that you should learn how to floss. You should learn the technique of flossing. Go to your dentist; he will teach you how to floss. The honest answer is 99% of India doesn't do it, and flossing is not something which is practiced so regularly in India because oral hygiene itself is not given its due importance. So if you start maintaining oral hygiene uh, as a gradual progression, and the next stage to it could be flossing and keeping your teeth clean in between where food also gets stuck, where your brush does not reach. But cooler options and newer options are also available in terms of water pick nowadays or a water flosser, where jets of water you can keep, spray in between your teeth, and they can clean the food particles, dislodge the food particles. So those are more practical than the flossing per se. I think so. Up to Saranya, if you have a different point of view, but that's
Nobody
what I
does
feel.
flossing. That's what I also know.
Yeah,
Even my own
nobody does floss.
parents, both are doctors, they don't floss their teeth. I tell them, but they don't do it. So practically it's difficult, but then 35 to 40% of your tooth attachment, so that comes under near the gingiva. So that's brushes don't reach there. So when we are brushing, only 60% of the tooth is exposed to brushing. So if you need to reach that 35-40% of tooth which is not there to brushing, then you need to do flossing. So yeah, flossing is a little next step, and I wish people do it.
Thank you. I think we should now wind up. Kirti, you have some more messages or something for the youth
Only
to
one
say?
last question, madam. And in the discussion, one of the dentists told that mouth guard is preferable for any play, and that is soccer, whatever maybe, the cricket or any gymnastics like that.
Yes.
So can you routinely advise mouth guard? Is it a good habit to have mouth guard during play?
Yes, sir. Ideally, any form of a lot of the dental trauma can be actually prevented if they have mouth guards during contact sports, and these mouth guards are very easily customizable. You get stock mouth guards also on Amazon. They may not be fitting snugly and may not be uh, uh, probably as good a fit as a customized mouthguard. A customized mouthguard, however, the flip side of it will be you'll have to go to a dentist, get your measurements done, and they'll make the mouthguard, get it delivered to you. But these stock-made mouthguards you can order regularly. So as beginners, if you want to start and get into habit of using mouthguards, you can try the stock mouthguard. Once you're more advanced into the game, once you are very serious with your gaming activities, then probably you can go in for the customized mouthguards, which are made in the dental clinic by the dentist by taking measurements and designing them especially for your mouth. So they are hugely helpful in protecting dental trauma and traumatology for teeth.
Thank you, sir.
Person, traumatic dental injuries in teeth.
Thank you.
I
Thank you.
think it's time to wind up. Dr.
Yes.
Shamil, we had a very
Yes,
good
I think so. We had a fantastic session. And the sweetest part is always the dessert. The interactions were part of the dessert. And I think so this session will be remembered for the interactions. Thank you to all the participants of today's session. Sankalp, you've been really, really good. crisp, concise, and very interactive. Dr. Senthil put together a lot of important and relevant points, and he got all his panelists to contribute towards very healthy discussion. The youth can never be forgotten, and I wish we can accommodate them sometime earlier in the program, because when the majority of the crowd is there, maybe we can just think about it, and brainstorm about it as to how we can hear their voices a little earlier in the program. So thank you so much to everyone. Our regards to our chairperson for all her innovative ideas and for making this 25th year of our academy so very special. Thank you, ma'am. And a big thanks to Professor Sudhir Mishra also for designing all the programs with sufficient time in advance. Until we see you again with our next edition, which would be on psychiatry, here's wishing all of you a very, very good night. And thank you for staying so long.
Thank you.
Thank you.
Thank you from my side too.
I would really
Dr.
like to thank the entire panelists and the team. Thank my very, very dear friend, Dr. Saranya. We were surprised, both of us were surprised when we were in this panel that
Both of you were so good,
she's from
Dr. Pankaj.
Coimbatore, I'm from Calcutta,
Yeah.
and from the entire of India, two of us were chosen for this. We were really, really thankful to the panelists. Shows that she is also doing great
I
work
think a big
in
round of
her
applause
field.
to both of them. The specialist pediatric dentistry, your presence made it very special for us, along with the youth voice, and of course our colleagues, Dr. Shiv Prakash Sosle. Thank you, Dr. Sosle, for joining, Dr. Kanya and Dr. Asava. Thank you, and of course our EB members, Dr. Senthil sir and Sudhir sir, everybody.
Yeah.
Dr.
Thank you,
Kirti
ma'am.
sir, thank you so much.
Thank you, ma'am. Good night.
Thank you.
Thank
Good night,
you.
madam.
Thank
Thank
you.
you. Thank you.
Arya sir,
Good
thank you for.
Thank you. Thank you all.
I think Taparia sir is also there, father of Dr. Sankalp.
Yeah.
Oh, is that?
He's
Sir,
late. It's
yeah,
too
I mean,
late.
you're
I
a
didn't.
pediatrician, sir. I came to know from Dr. Shamik and Sankalp ji and all of you. I mean, good. Thanks to, I mean, you know that you are, he's our colleague, Dr. Taparia sir, senior person. Sir, greetings from Central AHA, and we really thank you for joining this webinar. We look forward for working together in future.
Even I was not aware that
Thank you very
my
much.
dad is there.
Yeah. Thank you all of you.
Thank you.
Thank
Thank
you.
you, everyone.
Thank
Thank you. Bye-bye.
Good night.
Good night.
Good night. Good night.
It was nice listening to the all participants. मुझे डॉक्टर तापड़िया सर भी हैं
Yes, sir. Yes,
हाँ वो तो
sir.
मालूम है तो मुझे अरे वो भी देख
Thank you. Geeta madam is there.
Good night.
Geeta madam. Thank you, Geeta, for staying till long.